Hi, my name is Abria Bennett and I'm a student nurse at the University of South Alabama. Today I will be performing the neurological skill. I would first like to acknowledge that I have performed hand hygiene, and what I will do now is I will describe my patient's mental status with the ABCT. First, the appearance. My patient's posture is upright. My patient has good hygiene. My patient is dressed well and is groomed well. Now for the behavior, my patient does not have a lack of consciousness. My patient's facial expression, she is smiling, so I would know that my patient's mood is pretty good. Okay. Now what I would also like to acknowledge is my patient's speech is very thorough. Now, do you ever express any signs of anxiety, any signs of suicide, or wanting to have depression?
No.
Okay. If I sense that my patient had any of these, I will go further with a screening tool to further explore. Now, what I will go on to is the C, which is my patient's cognitive abilities. I will first assess my patient's orientation. Okay. What is your name?
Rashawn Brown.
Okay. The next thing that I will ask my patient is, what place are we in?
My home.
Okay. And what time of day is it?
Nighttime.
Okay. Now what I will do is I will then assess my patient's recent memory. Okay. What did you have for lunch today?
Baked chicken, rice, and cabbage.
Okay. I would like to verify that because I did share this meal with my patient. Now, what I would like to ask you is your remote memory. Well, who was the president before President Donald Trump?
President Barack Obama.
Okay, this is correct. Now, what I would like to assess is my patient's thought process or perception. Okay, beginning with reasoning. What does the phrase "a needle in a haystack" mean?
Difficulty or hard to find.
Okay, now judgment. What are your short-term or long-term goals?
Short-term goals would be to steer my kids through the right direction during this pandemic, and long-term goals would be to expand my business and get my two college kids through college.
Okay, this goal is realistic, so I would like to note that my patient's mental status is intact. Now what I'll move on to is cranial nerve number 1, which is the olfactory nerve, and I will test the patency of my patient's nostrils as well as her smell. Okay, I will ask you to breathe normally. Okay, now for the other nostril. Now I will have my patient to close your eyes so that you can note the senses. Okay, what is this scent?
Perfume.
Okay, that is correct. Now the second scent.
Hair product.
That is also correct. So my patient's cranial nerve number 1 is intact. Now what I will do is I will assess the optic nerve, which is cranial nerve number 2. In a normal hospital setting, we will use the Snellen's eye exam or the eye chart. And what I would like to know is 20/200 means that my patient could see at 20 feet, the normal eye could see at 200. Now what I will do is I will use my handheld eye chart. At 14 inches, I will ask my patient to read the lowest line.
DEFPOTEC.
Okay, and that is 20/20. So what I would like to acknowledge is what my patient can see at 20 feet, the normal eye can also see at 20 feet. Now I will assess cranial nerve number 3, 4, and 6, which is the oculomotor, which is the movement of the eye, the trochanter, which is the nerve, and the abductions, which is the field of gaze, and I will use the Perlat method. I would like to note that my patient's eyes are equal and rounded. They are symmetrical bilaterally, and my patient's pupil gaze is 4 millimeters. Okay, so what I would like to know is my patient's reactivity to light directly. My patient's eyes do constrict. Now, consensual. I am looking in my patient's left eye, and the right eye is constricting. Now for the accommodation, could you look at my finger? My patient's eyes constrict. Now looking at the wall, my patient's eyes dilate. Now looking at the convergence, could you look at my finger? My patient's eyes rotate towards the axis. Now what I'm going to do is I'm going to assess the 6 cardinal field of gazing. Would you watch my finger everywhere it goes? Okay, my patient's eyes are symmetrical, and I would like to note that my patient did have parallel tracking with no nystagmus. What I would do now is I would like to note that the cranial nerve 3, 4, and 6 is intact, And now to assess cranial nerve number 5, which is the trigeminal nerve, I will assess for the motor and sensory. Beginning with the trigeminal nerve, what I will ask my patient to do for the motor portion, I will assess the temporal and the masseter, okay? And the next thing I'll do is I will have my patient to clench her jaws, like this. And I will pull down against resistance. Good. So my patient has good muscle strength. And now what I will do for the sensory portion, I will ask my patient to close her eyes and to tell me when she feels me tapping on her face with my finger lightly.
Now, 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 now.
Okay, good. So the next thing that I'm going to do is I'm going to test my patient's facial nerve. Okay? Would you smile for me? Then I need you to frown. Show me your teeth. Okay? I need you to puff out your cheeks. Okay? I need you to raise your eyebrows. And next thing, I need you to close your eyes and do not let me pull up. Okay? My patient has good resistance for the facial nerve, and that demonstrated mobility and sensory as well. My patient has good cranial nerve number 7. It is intact. Now cranial nerve number 8, which is the acoustic nerve or the vestibulocochlear. What I will do is I will stand 1 to 2 feet away, and I will have my patient to hold one of her ears, and I will whisper a word. Okay?
Jaguar.
Okay, and now the other side.
Jones.
Okay, this is correct. I said Jaguar Jones, and I would like to note that the cranial nerve number 8, the acoustic nerve, is intact. Now cranial nerve number 9 and 10 is a glossopharyngeal and the vagus nerve. I would like to then assess my patient's mouth. I would like my patient to say ah.
Ah.
Okay, there is a rise in the midline in the uvula, which demonstrates phonation. I would also like to note that in a real hospital setting, I will use my tongue blade to measure the gag reflex, and I will use something that is salty, bitter, sweet, or sour, and I will place it on the 1/3 posterior portion of the tongue. Now for my patient's cranial nerve number 9 and 10 is intact. Now for cranial nerve number 11, which is the spinal or sensory nerve, I will be looking for any symmetry in my patient's muscle as well as strength. So I will assess my patient's neck and my patient's head. My patient's neck and my patient's head, and my patient's shoulders. And I would measure this using the trapezius as well as my patient's sternomastoid. Now what I will do is I will ask my patient to resist as I push her head. Okay? Now the other side. Good. And now the shoulders. Good. My patient has good resistance. Now moving on to cranial nerve number 12. I would like to know that cranial nerve number 11 is intact. So cranial nerve number 12 is the hypoglossal nerve. And what I will do is I will have my patient to protrude your tongue out. I would like to note that my patient's tongue is midline. Okay? And now I will have my patient to say the words light, tight, dynamite.
Light, tight, dynamite.
Good. My patient can say all 3 of these words. Now the next thing that I'm going to do is I'm going to do the motor system test, which is a cerebellar function balance test. I will have my patient stand. This is the gait test, and I will have my patient to walk 10 to 20 feet forward regularly. Good. I noted that there was no swaying. Now you can come back. Okay, and now what I will do is I will test for the Romberg test. Okay, and I will have my patient to stand here, arms by the side, and the feet together with your eyes closed. Okay, and I will do this, I'm verbalizing that I will do this for 20 seconds. Okay, this test is negative because my patient did not have any swaying. So I would like to note that the motor system is intact. Now what I will do is I will assess my patient's sensory with pain, and I will do this with the dullness and sharp portion. Okay, this is dull, this is sharp. Close your eyes and let me know which one that you feel. Okay?
Sharp.
Okay?
Dull. Sharp. Dull. Dull. Sharp.
Good. So I would like to note that my patient's sensory is intact. Now what we will measure is the deep tendon reflexes, and we will do this on a scale of 0 to 4. Would you take off your jacket, please? Okay. First, the bicep. You can sit. Now the tricep. Okay, now hold your hands like this. The brachioradialis. Now we will do the plantar or the quadricep. You put your hands down. And now I will measure the Achilles. And I would like to note that my patient did have a 2+ for this test. Now I would measure my superficial cutaneous reflex, which is the Babinski reflex. Okay, my patient's toes did curl, which means that this test is negative. And now to close out, I would like to note that the Glasgow Coma Scale, the purpose of the LOC over time is to know if my patient has any coma. The minimum that my patient could score is a 3, the maximum is a 15. And if my patient has a 7 or below, then it would note that my patient has some type of coma. For the eye opening on the scale 1 to 4, I will give my patient a 4. For the motor response, I will give my patient a 6 on a scale 1 to 6. And for the verbal response on a 1 to 5 scale, I will give my patient a 5. Thank you, and this will conclude my health assessment video.